Intramuscular injection define classification. Teacher Begum Talapqızı.
Definition: intramuscular injection is a type of parenteral administration of substances in which solution, emulsion, suspension are injected directly into the muscle. Intramuscular injection is installing medications into the depths of specifically selected muscles. The bulky muscles have good vascularity and therefore the inject drug quickly reaches the systemic circulation and thereafter into the specific region of action, bypassing the first pass metabolism. This picture we are looking dorsogluteal muscles. We need this place inject. What are intramuscular injection used for? Intramuscular injection are a common practice in modern medicine. They are used to deliver drugs and vaccines. Several drugs and almost all injectable vaccines are delivered this way. Intramuscular injections are used when other types of delivery methods are not recommended. These include: first, oral, swallowed into the stomach; second, intravenous, injected into the vein; third, subcutaneous, injected into the fatty tissue just under the layer of skin. What are intramuscular injections used for? Intramuscular injection may be used instead of intravenous injection because some drugs are irritating to veins or because a suitable vein cannot be located. They may be used instead of oral delivery because some drugs are destroyed by the digestive system when you swallow them. Intramuscular injections are absorbed faster than subcutaneous injection. This is because muscle tissue has a greater blood supply than the tissues just under your skin. Muscle tissue can also hold a larger volume of medications than subcutaneous tissue. Classification: we have four types. First, dorsogluteal region; second, ventrogluteal region; third, deltoid; fourth, vastus lateralis. Dorsogluteal region 5 to 7.5 cm below the iliac chest, upper outer quadrant within the buttocks. Ventrogluteal region, the heel of the opposing hand is placed in the greater trochanter, the index finger in the anterior superior iliac spine, and the middle finger below the iliac crest. The drug is injected into the triangle formed by the index, middle finger, and the iliac chest. And the deltoid 2.5 to 5 cm below the acromion process. Vastus lateralis, the middle third of the line joining the greater trochanter of the femur and the lateral femoral condyle of the knee. Dorsogluteal region. The first thing to understand about the dorsogluteal limb site is where it is located. For a visual, you should divide the buttocks into four quadrants. To locate the site of injection, you will simply find the upper and outer section of that grid. Please find this picture where our dorsogluteal muscles and which place we need giving inject. Ventrogluteal region. The ventrogluteal intramuscular injection site is located on the hip at the high part of the hip. To locate this site, it takes a bit of medical training, which we will provide you with. To locate it, you will have to place the palm of your hand on the femur on the part that protrudes. Place your index finger on the anterior iliac crest of the femur and spread your middle and the index finger away from each other. The injection site is in the middle of the V that is created when this is done. To find this site, you will need to know your anatomy quite well and ensure you are placing your hand in the correct location. Deltoid muscle of the arm. The first step is to locate the acromion process, the bony prominence where the head of the humerus articulates with the shoulder joint, as in the image above. On mass adults, this is simple to locate and is easily palpated. Asking the patient to relax the relevant arm is usually enough to allow palpation. However, if you are having difficulty, request that the patient extends their arm out straight at 90 degrees at the body. If the shoulder is then palpated across the top, there will be a knot or deformity at the joint. Place a finger in this dip and ask the patient to relax their arm down while keeping your finger in place. Your finger will then be in the correct place to palpate the acromion process.
Please find this picture where we need inject deltoid injection.
Vastus lateralis of the thigh. The anterolateral aspect of the thigh or vastus lateralis muscle is the preferred intramuscular injection site for neonates and infants. Up to 1 milliliter can be injected into this site in neonates, up to 3 milliliters in children, and up to 5 milliliters in adults.